Dallas County's health department is confirming the first case of monkeypox in North Texas. Hello, I'm Steve Eager. The patient is not in the hospital and is a Dallas County resident who traveled internationally in the past month. The Centers for Disease Control is working to contact passengers who may have been in contact with that patient on board a flight from Mexico to Dallas. There's also growing concern about the steady surge in COVID cases. The state is now averaging about 6,200 new cases per day. Fox 4's Alex Boyer live with both public health concerns tonight. Alex.
Hi, Steve. And what's really concerning to health officials is that both viruses are spread through close physical contact. And we know that many Americans plan to travel over the summer months. We now have this one confirmed case of monkeypox here in North Texas. And as you mentioned, COVID cases are now still surging in the southern and western parts of the country. It's not the summer travel news you were hoping for. New COVID cases are once again on the rise in Texas and other parts of the country.
But it's concerning that cases in the West and the South are still rising. Hospitalizations nationally are still rising.
Dr. Tom Inglesby is the former senior advisor to the White House COVID-19 response team. Inglesby says some 256 people are dying from COVID every day nationwide, making COVID the 8th leading cause of death in the U.S.
It's also a big concern that a third of the country is not fully vaccinated, and only 1/3 of the country has had a booster shot.
To make matters worse, monkeypox cases are starting to pop up. There's now 32 cases reported in 14 U.S. states, including Texas. On Tuesday, Dallas County reported its first case. The health department says a person who traveled from Mexico to Dallas by plane tested positive on June 6th. That person has not been hospitalized and is said to be at home isolating and recovering.
We know that monkeypox is typically spread in close person-to-person contact through respiratory droplets or through direct contact with skin lesions on or from bodily fluids.
We're going to be watching very closely emergency room visits, doctor visits.
Dr. Mark Casanova is a member of the Texas Medical Society COVID-19 Task Force. New COVID cases in Texas are up 19% in just 1 week.
It's also causing a little bit more serious illness, particularly one of these variants, acting very much like Delta.
Casanova says it's important to get fully vaccinated, and for those who are immunocompromised and fully vaccinated, he offers this recommendation.
And it's been 5 months since your last COVID-19 vaccine. You should get boosted.
And when it comes to monkeypox, Casanova says it's important anyone with viral symptoms, including a rash, should get tested for the virus. He says there's a simple precaution people can take to minimize their risk to both monkeypox and COVID.
You know, the recommendation would be that individuals pick those masks back up.
Especially, he says, if you're in a crowded space like a plane or a concert venue. Now, some encouraging news is that COVID cases are plateauing in other parts of the country. So medical experts predict that we should follow that same trend here in the southern part of the United States. We'll have to wait and see just what develops from this one new monkeypox case.